Alright, so we learned a lot in our prosthodontics class this semester about edentulism and about how to fabricate a denture. One of the big things we talked about early in the semester was how to think like a prosthodontist. So you need to be able to think outside the box and problem solve. And so two ways we did this was by playing a game called Toasters and Toilets, where we thought of ideas that would solve everyday problems. And then another thing we did was we made what was called our problem solving denture, where we were able to make a denture out of anything we wanted.
Alright, so there's a pretty consistent problem that I've found with toilets, is that they always seem to make a draining sound that never goes away a lot of the time. And a lot of it has to do with the way the plunger system works when you flush. The floater lifts up as the toilet drains. Of course, the little plastic lid flaps back down in place and covers the hole so that the toilet can no longer drain. The problem is that a lot of times the lid comes down as it's floating down into place, and it doesn't land exactly over the hole. So you have just a little bit of water that's consistently leaking down into the toilet, kind of making a little hissing noise a lot of the time. And I decided that it would be much better and more effective if you had a more rigid and it doesn't land exactly over the hole. So you have just a little bit of water that's consistently leaking down into the toilet, kind of making a little hissing noise a lot of the time. And I decided that it would be much better and more effective if you had a more rigid square type lid that when you flushed, it actually pulled the lid out of place and then slid it back in running on a track system so that it actually went into place each time, completely sealing off the water flow. Alright, so just going to work on my denture now. I was trying to think of what I could use to make it. It was just here, and I had some old hamburger that was in the fridge. Kind of gross, but been pulled out a while back and then got left in there, got kind of old. So not really good for eating, but I'm gonna make a denture out of it, cook it up, and see how it works. So here we go. Alright, so I've got it put together now, just ready to go stick it on the barbecue. It's a little bulky because I know the meat will shrink, so I'm hoping that once it shrinks it'll pull it onto the mold tighter, so we'll see how it works. Well, I know it's hard to see, but got my fruit and veggies shish kebabs, my chicken, and my denture all barbecuing together. Alright, well, my denture has cooked and it is now cooled, and it did shrink a bit. The teeth are not totally lined up anymore, but they're not terrible. Now we just have to see if it'll come off. And there it is. Hamburger denture.
We also had an experience with what we call the selfie denture, where we used just a quick set acrylic that we had to wear in our mouths for 24 hours, just to get a little bit of a feel of how much trouble a denture can give you, and how much of a struggle it can be to be an edentulous person.
Behind you. Alright, well, I'll be honest, I forgot to do this selfie denture video the other day when I wore my denture, so I'm just going to do it now, last second. But issues I had with the denture Mine was the biggest problem was that it just didn't stay in my mouth very well. Like every time you swallow, it would kind of fall out. Um, I don't know. It was annoying to have in there, period. Tasted like you were sucking down poison all day. So that was nasty. And yeah, not a real comfortable experience. I would imagine in order to make it better, obviously you'd want it to stay in better. Normal dentures you would assume would, unless you make a terrible denture for somebody. But so that wouldn't be an issue with a normal denture, but I think just in general,
So there are many different prosthetics available for edentulous patients, and we were able to talk about all the different kinds, some in more depth than others, but obviously one of the big constraints on people's decisions when it comes to prosthetics is the price. There's a lot of variation, anywhere from just your basic removable denture, which is around $2,000, $2,500, all the way up into some of the fixed ones, which can run anywhere up to 30, 35,000 for per arch. So there's a huge variation. Obviously, the fixed prostheses are going to be a lot more stable when you're chewing. You're going to be able to eat things on the upper end, like even apples and things of that nature. But as you move down towards your removable dentures, the variety of foods that you're able to eat obviously diminishes. You're not going to be as capable of chewing things that could pull your denture out easily. So the fixed, they're going to give a big time advantage as far as what patients are able to eat, and as well as how real it feels to their original dentition, since it's more stable and in place. However, some of the fixed, the big problems that can come with them, are, other than the price, are cleaning them. Cleaning them can be kind of difficult to do, and so they need to be taken in for professional cleaning by the dentist on a fairly regular basis, because the patient struggles to actually clean under some of the spaces. They get kind of hard to get to. So there's some videos and things we watched of patient experiences with the different prostheses, and it seemed to me like obviously it's going to be different for everyone, but most of the patients preferred the fixed prosthetics rather than the removable. And you can imagine that that's probably the case because of the increased variety of foods: steak, apples, like I said, some of those things that they're able to eat that they wouldn't been able to before with the removable. And then also just how they don't really think about it a lot. You don't have that mental thing in your head that you have your denture all the time, because you can feel it slipping around and moving. They're fixed, and it feels a lot more real for them. So they seem to be the preferred option. But of course, the price really dictated that. And so for those that were able to afford them, that had the removables in the past, seem to really prefer the fixed options. All right, so in our prosthodontics class this semester, we talked a lot about the theory of idealism, and what makes up an ideal smile. And of course, some of the big things when you're talking your macro aesthetics, just your teeth in relation to your face in general, and then meso aesthetics, which is going to be more in your teeth in relation to your gums and your lips, and then down to micro aesthetics, which is going to be your teeth in relation to your teeth, and where those locations are. And so the meso side of things and the micro we were able to discuss in what Dr. Durham called dress to the nines, and the stages that allowed us to reach this ideal look to our smile, or at least get it as close as we could when fabricating dentures. Of course, you have to follow the ridge when you're creating your denture, but these dress to the nine steps allowed us to go through the meso and micro aesthetics to make the smile as ideal as possible. So in your dress to the nines for meso aesthetics, you're going to first look at your buccal lingual position of the maxillary central incisors. You want them to be spilling like a waterfall down into the vestibule on your mandible. And then you're second going to look at your incisal length of the maxillary central incisors. Third, you're going to look for maxillary occlusal plane angles to make sure they're parallel to the Camper's plane. Fourth, you're going to look at the buccal corridor. So you want to try to land that as close as you can between the center of the pupil and the center of the iris. Fifth, you're going to do the maxillary midline position. And then sixth, you'll do the maxillary midline angle. You want that angle to be 90 degrees to your zenith line so that you don't have a cant to it, because that's really noticeable. Seventh is the zenith line. So the tops of the teeth have a line that basically connects them as you move along the dentition, and that is your zenith line. And then eighth is buccal lingual position of the mandibular central incisors. So you want to be placing them in relation to where you have set your maxillary centrals. And then step 9 of dress to the nines for mesoaesthetics is going to be the incisal length of the mandibular central incisors. So basically setting them so that they're showing 2 millimeters at rest and while smiling. And then during phonetics, they can show up to 6. All right, and then for dress to the nines for the microaesthetics, we are talking about the tooth-to-tooth relationship. So first, we want to look at the central maxillary papilla and make sure that it's right in the midline. Second, we want to make sure that that midline is perpendicular to the incisal edges. So an important step in that is when you're grinding down your cast, you want to make sure it is parallel with your wax rim so that everything's squared off. The third step in dress to the nines for the microaesthetics is going to be proportions of the maxillary central incisors. We want to make sure they're not too big, not too small, so that we don't have chiclet teeth sticking out there. The fourth one is going to be the width of the maxillary anteriors. And so as we move along the teeth, we have essentially size X on the centrals, and then X-2 laterals, and X-1 to the canines, so that we have a relationship between them on width. The fifth step is actually going to be the length of the maxillary teeth. So this is going to be your centrals and canines at about 10 to 12 millimeters, and then the laterals and bicuspids at the X-1. So whatever your central and canine length is, your laterals and bicuspids are going to be -1 off of that. The sixth step is going to be apical progression of your contacts and embrasures, so that they are raising as you're going towards the posterior. And then seventh step, harmony of the posterior cusp edges. So you want them on the same angles as your cusps. The eighth step is going to be symmetry of the zenith and anti-zenith positions and angles. So as you're coming, the angle that's coming down from your zenith points on the teeth, you want them to be symmetrical. And then the ninth step is the length of your papilla. So basically you want that set at about 40% the length of the tooth. So you want to make sure those line up, and then that, along with your zenith lines and your apical progression of your embrasures and contacts, makes for a really nice, symmetric, consistent smile. And that's basically the theory of idealism, the dress to the 9 steps. The microaesthetic side of it is really important, of course, in setting the teeth when you're at that point that you're going to be setting them into your wax rim. But yeah, that's basically a nice quick summary of some of the things we've learned about the theory of idealism. All right, so after doing our class, obviously I know a lot more about making a denture. The one I turned in before, you could tell I knew nothing about it. But basically what I still remember from how to do a denture is you take the initial impression, you then go in and pour up those impressions in just a soft stone. Then you come back out, and you're going to then put like Vaseline over your stone model so that the acrylic resin doesn't stick to it.
You'll place your acrylic resin sheets onto the model, cure it on, and then build your Wade Newton rim onto that. So building your wax up right onto the acrylic, and then you'll just start fitting it, I suppose, into the patient. You'll stick it in, and then you get the PVS, and you'll use like a heavier body first to fill in all the larger spaces. You'll cover your tray, your resin tray that you built your Wayne Newton rim with that resin, or with the PVS, and place it into the mouth. It'll take the initial impression. You then take bigger spots that have been, when you place it into their mouth, and put the heavy body back into those areas, or areas that you just need smaller stuff or lighter. You just use the light body PVS to sneak into some of the smaller spaces, and you just do that until you get a nice impression of their mouth, and a nice enough one that you can send it into the lab. You then go to the wax and measure the facial dimensions in the way that you want them, to match your what you're looking for in your ideal smile. Yes, and that will match the patient. And once you get the wax all trimmed down to the dimensions you want it, so the teeth are ready to be set, you will send it into the lab. They'll set all the teeth and everything for you. You'll then get that back and make sure it looks the way you want it to look, your patient wants it to look. Make sure it fits well, it's not rubbing or anything in any spots. Make sure it's totally comfortable, and then you will send that back in, get your final product, and then you'll do your final seating, where you have to make any adjustments you need as far as like occlusion or anything like that. And I guess that's my understanding of how to make a denture.
Okay, so this semester we talked a lot about denture fabrication. We were able to do the steps on a mannequin as well as a live patient experience, which was fantastic. We were able to go through each of the steps of that fabrication, and talk about why we were doing them the way we were, and how we could get away from the way that it used to be done, and instead do quicker methods that were still just as good in the fabrication. There were a lot of things that, when we talked about in class, as well as in some articles we read, that there's a lot of dogma out there in the prosthodontic world that things have always been done one way, and so everyone just assumes that that's the way it needs to be done. But in reality, there's a lot of things that we can change, and that we can make quicker, less expensive, and make it better for us and for our patients in the long run. So we were able to go through that stuff, and learn a lot from that. And then also we were able to go through principles of tooth setting, and to make sure that we're remembering important principles aside from some of those things I talked about in the theory of idealism with the dress to the nines. On top of that, talk about the way that we have occlusal contacts. One of the papers we read talked about how 1 point of contact for each tooth was enough in order to give us the stability and things that we needed, and the importance of that, just in the fact that only having that one contact per tooth gave us quicker fabrication, more ease when it came to needing to do adjustments and things. Just the simplicity of that, and once again taking a step forward to simplify things in a way that hasn't been the way it's done in the past, but a way that's probably better for us as the dentist and as our patient in the long run, because of the time that it saves, the money that it will save, and just some of those things. And so with that tooth setting, like I said, the stability of occlusion, making sure that we're taking into account the variability of the TMJ, and also some things like the forces, both centric forces acting as well as excursive forces, and just making sure that all those things balance out to provide a stable aesthetic occlusal dentition once we have set those teeth. In class, we also talked about how we can do relines, rebases, repairs on dentures. And then we were able to spend a little bit of time in lab, not a ton, but we spent one of the weeks just working on putting in new abutments and things on our dentures. And so I have some pictures that are going to show kind of a little bit of what we did. And one of the last things here that I'm going to talk about is just professionalism. We're able to talk about what it is to be a professional, and how important professionalism is when interacting with our patients and running our business as a whole. Professionalism in just the fact that we have the skill, the judgment, and hopefully the behavior that's going to be expected of a person who's trained to be a professional in the thing that they are doing. And so us in the dental profession, our professionalism is to be able to just show respect not only for the work that we are doing and for the field of dentistry, but also to show respect for our patients and help them to know that we're here to help them and that we respect their opinions, and their wishes, and that we're going to be able to do everything that we can to help them with the goals and the desires that they have for themselves and for their smiles, and for their overall health. And so just being able to incorporate those things, our behavior and our skills all together into one thing, and calling it professionalism and making sure that we are being professionals in both our actions and in our treatment for our patients. All right, so I watched the TED Talk on bionic limbs, and as I was watching it, I was trying to think of, ideas as far as prosthesis and stuff for the jaws as well. I didn't think of anything specifically regarding edentulism, but I couldn't help but think that that same bionic technology could be used for the jaws. Of course, they were replacing missing limbs with the bionics, but what I found that was really interesting was the fact that they were building exoskeletons, which would help to reduce wear on the major joints and things as well, and just the level to which the technology has progressed. And I thought, it'd be really nice for someone to be able to have like a TMJ replacement with one of these bionics and the way they function. Obviously, you don't want to strap an exoskeleton onto your face to help your jaw, but if you have these people that have TMJ issues, it can be one of the biggest problems for chronic persistent pain. It can be a real detriment and can be a real debilitator in their lives. So if you were able to take this bionic technology, I feel like it wouldn't be that big of a stretch to take it and apply it into a surgery where you can replace these jaws. The bionics work in the same way they work on the limbs through nervous system impulses and things, and you're able to have a fully functioning TMJ in the form of the bionics. So I just thought that would be something that wouldn't be that hard, since the technology is already in a large part being perfected, that it wouldn't be that much of a stretch to incorporate it into using it for like TMJ replacement.
We have really learned a lot this year about edentulis, and so I wanted to tell you all about this and how you can have dentures with the edentulis, and it really helps your teeth stick in your mouth, and you won't get sores with the edentulis, and I recommend it.
Good job.